Hello everyone. Today we will study the most interesting topic of the head and neck anatomy, the muscle of facial expression. Unlike most of the skeletal muscles, the muscle of facial expression originates from the bone or the fascia, but insert into the skin rather than another bone. When they contract, they produce different kind of facial expressions. All the muscles are supplied by the facial nerve. It enters the parotid gland. Here is the parotid gland and divides into the branches: the temporal branch, the zygomatic branch, the buccal branch, marginal mandibular branch, and the cervical branch. Now the first muscle is the occipitofrontalis muscle. This is the occipitofrontalis muscle. It starts from here and up to here. Okay, this is the occipital part and this is the frontal belly, and both of these bellies are connected by epicranial aponeurosis. That's why this is also known as epicranium. The frontal belly originates from the epicranial aponeurosis here and insert into the skin of the eyebrows and forehead. When it contracts, it raises the eyebrows and produces the horizontal wrinkles, and gives the appearance of surprise. Now the muscles around the ear, number 22. This is the auricularis anterior, auricularis superior, and this muscle is the auricularis posterior. Three muscles are completed around the ear. The muscle around the eyelids. The major muscle is the orbicularis oculi. It is the orbital part. This part is the orbital part. This part is the preseptal and the pretarsal part. Three parts are completed around the eyelid of the orbicularis oculi. So this circular muscle is known as orbicularis oculi. And this muscle is the corrugator supercilii. This muscle is the corrugator supercilii. This orbicularis oculi muscle is very important in closing the eye tightly. The paralysis of the orbicularis oculi occurs in facial nerve palsy, that is the Bell's palsy, producing inability to close the eye, resulting in exposure of the keratitis also. So this was the corrugator supercilii. This is going like this. This is the corrugator supercilii. So this next muscle is the procerus. This is the procerus muscle. Next muscle is the compressor nares. This muscle is the compressor nares. Okay, and this is the depressor septi. This tiny muscle is the depressor septi. So these are three muscles: procerus, compressor nares, and this one is the depressor septi. These muscles are of the nasal area muscle. Now the muscle around the oral cavity, this is the orbicularis oris muscle. As you can see here, it is covering here like this. It acts as a sphincter of the oral opening and closing of the lips. Next muscle is going upward. It starts from the lips and elevates the lips, so it is known as levator labii. Labii means lips, levator that elevates. So we say it is the levator labii. It is going upward, so we say superioris. Alas, it is crossing the ala, so we say it is aliki. And nasal cavity, the nasi. So this muscle, as you can see here, this muscle particularly is known as levator labii superioris aliki nasi. It elevates the upper lip while the nostrils are dilating. After that, This is the levator labii superioris echinacea. So next to it is simple levator labii superioris. And this muscle is the zygomaticus minor because it is going under it, and this muscle, this is the zygomatic bone, so it is attaching over the bone number 20. It is known as the zygomaticus major. I am repeating, this is the levator labii superioris echinacea. This is simply the levator labii superioris. This is the zygomaticus minor, and this one is the zygomaticus major. Okay, and this one is the buccinator muscle because this is the parotid gland, and the parotid duct is piercing the buccinator muscle. So it is the muscle of the cheeks, the muscular wall of the cheek, and it is also considered as the muscle of mastication because it can assist while the chewing because it is forming the major wall of the cheeks. Now this muscle, which is number 25, it is going from the angle of mouth towards the parotid gland. This muscle is known as rhizorius. This muscle is known as rhizorius. Now again I am telling you, this one is the zygomaticus major. This is buccinator because the parotid gland is piercing the buccinator muscle. This is the rhizorius muscle. Okay, this is rhizorius muscle. This one is the masseter. This one, this muscle is the masseter, and this was the rhizorius. This muscle is the levator anguli oris. Levator anguli oris, and this is going downward, so this is known as depressor anguli oris. This muscle is known as depressor anguli oris. It is going from the angle of the mouth downward. Now this muscle is known as depressor labii inferioris. This, because it is going downward, so we say depressor. From lips we say labii. It is lower muscle, we say inferioris. So this muscle is the depressor labii inferioris. This is mentalis muscle. Mentalis muscle. And this huge muscle is the platysma muscle. This huge muscle, complete. As you can see here, this complete muscle is known as platysma. Platysma muscle is the final muscle, and it is thin broad sheet of muscle located in superficial fascia of neck. This muscle is located in the neck, superficial fascia of neck. Okay, and it extends from the upper chest, and it is going in the region of the shoulder, lower part here, as you can see here. You can tense your neck while clenching the teeth. You can feel the prominent vertical bands appear on its contraction. These muscles are supplied by the branches of the facial artery, and the nerve supply is the facial nerve. The motor supply is the facial nerve. If the facial nerve get damaged in any condition, it leads to the Bell's palsy. Bell's palsy, in which the inability to close the eyes, drooping of the angle of the mouth occur, loss of forehead wrinkles, inability to smile on the affected side, difficulty in whistling and blowing. I have completed all things now in detail. If you find this lecture helpful, kindly tell me. Okay, thank you so much for watching. Allah Hafiz.